lifestyles of many people shift to become more sedentary, more and more people are being diagnosed with what medics call lifestyle diseases, which includes cardiovascular diseases. Cardiovascular diseases, or CVDs, are a group of disorders that affect the structures and the functions of the heart and include such conditions as heart failure, congenital heart disease, coronary artery disease, and many more. According to the World Health Organization, an estimated 17.7 million people died from cardiovascular diseases in 2015, representing 31% of all global deaths. Over 3/4 of deaths related to cardiovascular diseases take place in low and middle income countries, and Kenya is among these.
A combination of urbanization, lack of exercise, and the kind of foods that we are eating are really contributing to the increase of cardiovascular diseases. And for those patients with high cholesterol levels, of course, they are at risk of getting these coronary artery disease.
And then the lifestyles that, say, our grandparents or great-grandparents had is not what we're living, it's not what's being lived in the rural areas anymore. And so with all that, we're finding a lot of diabetes and high blood pressure, which are major risk factors for heart disease.
The Kenya Cardiac Society is a non-governmental organization that is putting together efforts to promote and maintain the highest standards of cardiovascular care through the prevention of cardiovascular diseases and the education of the public. So just what is the current situation of cardiovascular diseases in Kenya?
Right now, they're commonplace and the numbers are increasing drastically. The statistics, we're still gathering information as part of the, say, Kenya Cardiac Society and the general stakeholders in the health industry. So we don't have the accurate numbers at the moment, but from just general experience or day-to-day experience, the numbers are alarming.
Among such risk factors such as lack of exercise, weight, high blood pressure and diet, cardiologists say smoking is a leading cause of cardiovascular diseases.
In sub-Saharan Africa and in the developing world, we actually finding that the number of people who are smoking, the number is going up. In fact, most of the young people, women and youth, a lot of them are taking up smoking.
Last year, during the World Heart Day, the Kenya Cardiac Society spearheaded local efforts towards the prevention with calls for proper infrastructure to enable more surgeries for patients of cardiovascular diseases and the need for more cardiologists to attend to the cases.
The limiting factor before was pay. That are you going to be able to make as much money here as you'd make there? And we're finding that with the economic changes that have come over the last 10 years, that then we're able to afford hospitals are able to pay doctors much better than before, but we still don't have enough doctors.
Take care of the Kenyan heart problems by way of making sure that we don't miss the operations. Our patients do not miss these operations. Many go abroad just because the facilities are overwhelmed. The waiting list goes to another 2 years or more from today, and that is a long way to wait for heart surgery.
If we can prevent disease, then there's more money to treat those who do get it. Whereas if a lot of us are getting, say, heart attacks or strokes, then the economic burden on a system that's where we all put money in will be quite tremendous.
I eat a lot of vegetables. Fast foods I eat rarely, like once in 2 weeks.
I do, of course, a lot of walking. And at the same time, I do go to gym occasionally.
To make sure that you are healthy, you have to eat healthy, a lot of fruits, a lot of greens. You have to do a lot of exercise. Yeah, most of the time you walk.
The Kenya Cardiac Society has committed itself to a future of prevention of